right. Hey everybody, I hope you had a great day today. Feeling a little bit more warm now that the snow has stopped. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are talking about stretches for lower back and hip. So that old song of the hip bones connected to the thigh bone, the knee bone, all that other stuff is so true, and it's so true when it comes to stretching. It's really difficult to stretch one muscle independently. You really are going to have to stretch a group of muscles, and usually what happens is you can't really just stretch your low back because everything in your hip comes and attaches at your low back also. So that's a really important thing you have to understand, especially when it's about stretching. Just stretching your hamstrings isn't really going to do much, because if your calf's tight, that's going to pull on your hamstrings. If your low back is tight, that's going to pull on your hamstrings. So while you may be able to isolate and stretch only the hamstrings, if you're not stretching above and below, it really can lead to some more issues. And if you've watched our videos, and we have a ton of them on Total Performance Physical Therapy, on our YouTube channel, on our Facebook page, you know I'm a big believer in foam rolling, and that I believe is the way to go as opposed to stretching. However, when you're sitting there throughout the day and you're getting stiff and tight, if you want to throw a stretch in, absolutely. I stretch. I do not do a religious 15-minute stretching program every day. No, I'm not going to sit here and say that I do, but I do stretch. If I'm sitting down, I am stretching at my desk in some way, shape, or form. And a lot of the stretches I do are lower back and hip. So the ones I'm going to show you tonight are going to be for both of them, and it's just going to kind of encompass that lower back and hip area. Maybe one is more specific to the hip, maybe one is more specific to the low back, but it's going to be things that you can do that are going to have those changes on both the low back and hip. Again, you cannot effectively change the low back and ignore the hips. You just can't. Everything's connected. So that's what makes a lot of these problems more difficult and can really cause you a lot of serious pain, is because everything is connected. There is no way to separate out the low back from the hip. So the first stretch we're going to do, and if you follow me and you watch our YouTube channel, you know it's one of my favorites. It's just the figure 4 stretch. This is one I do all the time sitting at my desk. It's a very easy stretch to do. You can't even tell that I'm stretching. Honestly, it just looks like I'm sitting here with my leg crossed over my knee. The key point in this, you want to sit up nice and straight, and you want to hinge forward at the hips. You don't want to slump down, all right? Otherwise, then you're actually just going to be straining the low back. You never want to apply pressure or put yourself in a position where you wind up straining yourself when you do a stretch. I know partner stretches are huge, or they were before COVID, and I've seen a lot of people get their hamstring stretched to the point where tears are rolling down their faces, and they're being pushed beyond their limits, and that's a no-no. You should never, ever, ever feel pain when you're being stretched or you're doing the stretching. So if you feel pain, you want to back off until you feel a nice, gentle stretch. So with this stretch, you can feel this in the low back, you can feel it in the butt, you can feel it in the hamstring, you can feel it in the side of the leg. It depends on where the muscle is the tightest. So don't think that you need to feel it in your glute area. You may not feel it in your glute area. You may feel it somewhere else, and that's okay. Stop when you feel a good stretch, no matter where it is, all right? If you feel a stretch sitting here, this is where you stop. If you are like, I don't really feel much here, you're gonna sit up nice and straight and hinge forward at the hips. Count to about 30, and then do it 6 times on each side. Honestly, I sit like this for 5 minutes. I allow gravity to do the work. Gravity's slowly pulling on my knee. It's called more of a prolonged stretch, which is actually more beneficial. So don't think you have to count to 30 and get into this involved stretching routine. It's really not that difficult. You want to make sure that you are just in the proper position. So you can lean forward like this. No one will know you're stretching. You can sit like this for minutes at a time and be totally fine with it. Now, if your knee's up like this, obviously, that's an indication there's some dysfunction going on. There's a problem in that hip area, low back complex, something that you don't want to ignore. And especially if you have periods where you have pain in your hip or pain in your low back, even if it goes away, if your hip's up like this, that's an indication something is going wrong. And you really need to address it. Don't ignore it. That's a really big warning sign that it's going to snowball. It already is snowballing, and you're going to have an issue. So then all you can do is you just switch over to the other side. Again, let that knee drop down if this is where you feel the stretch. Great. Now after sitting here for 5 minutes like this, you may feel better and you may feel stretched out and you may be able to actually take that hinge in your hips and lean forward. But when you first do this stretch, this may be enough and you may be like, oh, I feel a stretch. Let it go. Do not force your knee down. Just let gravity work on it, okay? Again, you can sit like this in a meeting. You can sit like this on a Zoom meeting. No one's going to know you're stretching, but it's really going to help open up your knee, or open up your hip and your low back. The next stretch you want to do is you're going to do a hamstring stretch. So I'm going to show you these just kind of sitting in your chair, since so many of us are sedentary these days. I'm showing you things that you can incorporate throughout your day, and it's important that you do so. Again, I don't do a full stretching routine. I don't know many people that devote that 15, 20 minutes that you should be doing to do it. But if you can just sit there and do these easy stretches throughout the day, it's going to make a world of difference. So this, again, you're sitting at your desk, straighten your leg out, put your heel down, sit up nice and straight, and lean forward, okay? Again, this is the important, you have important hinging from the hips, all right? You're not collapsing forward. You're not trying to touch your toe. That's not the goal of this exercise. You want to make sure your knee is straight. You don't want it bent. You want your heel on the floor. You want your toes pulled back. You may feel a stretch right here and not have to lean forward. That's fine. Again, if you're getting pain, back off the stretch. If it's too much here, maybe you just point your toe, all right? And you don't pull it back. And actually, this is a very effective way to kind of get some of those nerves moving, is what we call flossing, is where you can just point and flex your toe and kind of allow that nerve to glide through those muscles going back down the back of your leg. So be aware that if you can't pull your, sorry, I got tongue-tied. If you can't pull your toe back towards you, you want to make sure that you are doing some active, what we call flossing, just pointing and then bringing your toe up. Work in the area of comfort. Don't bring it all the way back up if that's causing shooting pain. You know, if this is all you can do, just a little point and bring it back, point and bring it back, that's fine. If you can do a little bit more, then do a little bit more, all right? But you're gonna feel this either in the back of the leg and the hamstring, either in the calf, in the butt, sometimes in the low back. Again, you stop when you feel that stretch. Just because it's called a hamstring stretch doesn't mean that's exactly where you're gonna feel it. And then again, you can switch legs. These are very non-conspicuous stretches that you can do throughout the day and that you should be doing throughout the day. And again, you can always throw that little toe floss in there, that point and flex if it's really painful, if you're getting burning down your leg. But what you don't want to do is you don't want to slouch down and then try and stretch your hamstring. You might get relief from some of that pain going down the leg when you do this, but it will not be effective and you're actually straining your low back. The final stretch that you want to do for your hip and for your low back is just a cat and cow, all right? And this is just, I'm going to show sitting it down because again, I'm trying to show you things you can do throughout your day. So what you can do is just slouch in your chair and then sit up as straight as you can. And then slouch in your chair and sit up straight as you can. Couple quick repetitions of this, 15, 20, can really open up that low back. But you want to make sure that you're going all the way back, slumping as far as you can, and then sitting all the way up straight. So you're taking that range of motion. You're using the range of motion in your hips. You're using the range of motion in your back and your pelvis to its full extent. Nice and easy. You don't want to stay like this. You don't want to stay like this, all right? But allowing that gentle motion can help. Now this, when you get a little bit more, people might look at you a little bit odd if you start doing this. So, but again, this is not something that you're going to have to do for 5 minutes. You can just sit there while you're typing and gently do it. You also don't want to fly through this, all right? You don't want to go fast. It's a very slow, deliberate movement. So make sure you're really just emphasizing going all the way down and going all the way back. That really can help loosen up a stiff back and even into the hips. If you or someone you know is suffering from hip or knee pain or back pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.